Hi, my name is Marta Zinyuk, and this is Randall Crowder, and I am recording a comprehensive physical head-to-toe assessment for NU650 Advanced Health Assessment. Randall, do you give consent for me to record this head-to-toe health assessment?
Yes.
Okay, thank you very much. I'm going to go ahead by washing my hands and making sure the patient is in the correct position, which Randall is in. And then I'm going to go ahead and start by inspecting his skin. His skin is intact, eyebrows are intact, no lesions. Temperature is normal, no excessive sweating or dryness. I'm going to inspect and palpate his scalp as well. No lesions, hair is evenly distributed, no hair loss. Okay, then I'm going to go ahead and inspect his head and face. No abrasions, cuts, no bruises, symmetric with normal expression. He does not have any edema, no masses or drooping. His nose is midline. Then I'm going to go ahead and assess his cranial nerve number 7. Randall, will you please raise your eyebrows, frown, close eyes really tightly, smile, and then while your mouth is closed, puff out your cheeks. Perfect. Then I'm going to go ahead and assess his cranial nerve number 5, which is for sensory loss. And I'm going to do that by grabbing a piece of a Q-tip. And I want Randall to tell me, do you feel that?
Yes.
Okay. Very good. So he has his sensory. Next is I'm going to assess Randall's eyes. His eyes are the same size, color, and shape is the same. His lids and lashes have good consistency. He doesn't have any swelling, no discharge, no redness, no swelling. Pupils are appropriate size. I'm going to grab my lights and look into Randall's eyes. Okay, his sclera is white. Very good. Then I'm going to assess Randall's visual acuity by showing Randall the Snellen chart. Okay, Randall, can you please read the smallest letters that you possibly can?
LEFODPCT.
Okay. Perfect. Next, I'm going to assess Randall's Randall's pupillary response to light, both direct as well as consensual. And I'm going to do that by dragging a light across one eye and then both eyes. So Randall, will you please? Okay. Same from this side. And then both eyes. Okay, very good. All right, and then I'm going to test the accommodation. Randall, will you please follow this light with your eyes? Okay, very good. Then I'm going to test Randall's extraocular movements, cranial nerve number 3, 5, and 6. And Randall, will you follow my fingers to 6 points? So I'm going to start in the middle. Okay. Midline. Back to midline. Okay. All right. Next, I will go ahead and check and identify the red reflex in Randall's eyes. Okay. This side. Alright, very good. I saw the red reflex in Randall's eye. Next, I will go ahead and inspect Randall's ears. The auricles and the surrounding tissue look symmetrical. No deformities or lumps. Okay, no lesions. And I'm going to palpate Randall's ears for any tenderness. Okay, is that hurt at all?
No.
Any tenderness? All right. I don't feel any lumps either, no deformities. All right, Randall, I will go ahead and check the inside of your ear now, okay? Right. I'm gonna do this by pulling up and then, by pulling up and then back. Eardrum is pearly white. Skin is pink, no foreign bodies, redness or swelling. I'm gonna do that to the other eye as well. The other ear as well. All right, no foreign bodies, eardrum is pearly white, skin is pink. Perfect. Next, I will test Randall's auditory acuity. I'm going to whisper a word on one side, and I want you to repeat it.
Blue. Baseball.
Perfect. Okay, next I will inspect Randall's neck. His neck is symmetric. There's no masses anywhere, no scars, no enlargement of glands, no visible lymph nodes, no jugular venous distension, and I'm going to inspect and palpate the trachea for any deviation. Okay, his trachea is midline. Next, I will go ahead and palpate Randall's lymph nodes. I will start with the preauricular, which is right in front of his ear. Okay, preauricular. Then posterior auricular, which is behind Randall's ear. Then tonsillar, angle of the mandible. Then occipital, which is posterior to his skull. Submandibular, submental, superficial cervical, posterior cervical, deep chain, and supraclavicular. Okay, his lymph nodes are mobile and they are non-tender. Doesn't hurt when I do that, right? Okay, thank you, Randall. Next, I will go ahead and inspect and palpate Randall's thyroid gland at rest, and then with swallowing as well. Does that hurt? Will you go ahead and swallow? All right, next I will assess Randall's cranial nerve number 11. Randall, will you go ahead and shrug your shoulders up against my resistance though? Okay, very good. And then move your cheek to the right as I put pressure, and then cheek to the left as I put some pressure. Okay, then I'm going to assess Randall's flexion, extension, rotation, and lateral bending. Randall, put your chin to the chest. Look at the ceiling. Look over your shoulders. Okay, and then your ear to shoulder. Perfect. Okay, very good. Next, I will go ahead and assess Randall's thorax. I'm just gonna put my hand in here. Okay. Respiratory rate is normal. It is about 16 per minute. Rhythm is normal. Normal pattern. Respirations are deep. There's no retractions or bulging. The color of his skin is not cyanotic. No redness, lesions, or he doesn't have any redness, lesions, or any cyanosis. His chest is symmetric. He does not have a barrel chest. No pain, or do you have any pain or tenderness?
No.
Okay. There's no accessory muscle breathing, and no labored breathing either. Okay. I'm going to check the lateral diameter, which is about half that from left to right, and trachea is midline. He's not in a tripod position. Okay, then Randall, turn this way. All the way, turn around. I just need to feel your back here all the way. Okay, I'm going to go ahead and lift your shirt, okay? Thank you. So I'm going to put my hands under Randall's rib cage and feel for back extension. Okay, breathe. Okay, breathe. The chest expands about 2 centimeters because my fingers are about 2 centimeters apart when he's breathing. Okay, and then I'm also going to check for tactile fremitus. Okay, Randall, whenever I do this motion, I want you to say 99. Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, vibrations are equal and there's no abnormalities. Okay, thank you. I'm also going to go ahead and auscultate the lungs. Okay, Randall, breathe. I'm going to note the pitch, intensity, and intensity and duration. I don't hear any adventitious sounds. Hollow pitch, no crackling. Okay, very good. Randall, I'm gonna have you lay down, okay?
Let's go. Sorry, I hit your phone.
Okay, go ahead.
Lay down like this on my back?
Yes.
Back or front?
What?
Back or front?
Back, yeah. But I need your head a little. Move as far as possible back.
Yes.
Okay. Okay, I'm also, if you can please take your shirt off as well.
Yes.
Okay, very good. So I'm going to palpate. Okay. I'm going to palpate Randall's carotid artery one at a time. Okay. Okay. All right. Then I'm going to go ahead and listen to Randall's heart sounds with both the bell and the diaphragm of the stethoscope. All right. So the first one I'm going to listen to is the aorta, which is the second intercostal space. Pulmonic, also second intercostal space. Erb's point, which is the third intercostal space. Tricuspid, which is the fourth and fifth intercostal space. And then the mitral and apex, which is the fifth intercostal space. I'm also going to do that with the bell side as well. Okay, doesn't have any murmurs. Okay, very good. Next, I will go ahead and assess Randall's abdomen. I will start by inspecting his abdomen, and I don't see any bruising, no scars, no striae, no rash. It's flat. I don't see any bulges. I'm gonna auscultate all 4 quadrants. All right, I'm gonna start with upper right quadrant in a clockwise. Okay, lower left quadrant, lower right quadrant, upper left quadrant. Okay, he has all normal sounds, about 5 to 30 per minute. Then I am going to auscultate the aorta with the bell side of my stethoscope. And this is right below the xiphoid process. And so his aorta is right below the xiphoid and then right above the umbilicus. No bruits, no thrills. Okay. Then I'm going to auscultate his left and right renal arteries. Okay. And then the iliac crest, which is right below inferior and lateral to the belly button, as well as the femoral arteries. I'll also check his liver and spleen as well. Liver, spleen. I don't hear any hums or any friction rubs either. Next, I'm going to percuss all 4 quadrants. I'm going to go put my stethoscope down. Start about upper right. Okay, dullness over the organs, some tympanic. Okay, then I'm going to palpate superficially for any inguinal for any lumps or masses. Okay. Do you feel any tenderness, Randall? Okay, very good. Next, I'm going to estimate his aorta. So let's see. Okay, no presence of a pulsatile mass, and his aorta is very skinny, which is good. Under 2 centimeters. Okay, very good. Okay, then I'm going to go ahead and do some deep palpations as well. And I started with the light palpation because I wanted Randall to get used to the palpating motion. There's no rigidity, no lumps, no guarding, no masses. I'm going to identify the liver edge by the hook down and upwards. Okay, just going to do a little hook and then upwards. Okay, and then identify the spleen, which is hidden behind the ribs, so you can't really feel the spleen that much. And then I'm going to reach under to feel the kidneys, and his right one should be slightly higher than his left. All right, Randall, will you sit back up, please? You go put your shirt back on.
Thank you.
And I'm going to assess for CVA tenderness. So go ahead, go back in the same position. I just need you to turn this way for a moment. Thank you. You don't feel any tenderness?
Nope.
All right, so there's no CVA tenderness. All right, go sit back. So next I'm going to inspect Randall's upper extremities, and I'm going to start by inspecting his nails. Okay. No clubbing or cyanosis. Okay, I'm going to assess Randall's flexion, extension, abduction, and adduction of his thumb. So Randall, move your thumb down, thumbs down, thumbs up, thumbs out, thumbs in. Okay, very good. Then I'm going to assess Randall's grip. Randall, will you grab my fingers? Okay, very good. He has a good grip. I'm going to assess Randall's abduction. Spread your fingers. I'm going to try to force the close. Okay, very good. I'm going to assess Randall's flexion with your palms down. Straight forward. Hands. Okay, fingers to the floor. Okay, fingers to the ceiling. Fingers midline and away from midline. Okay, next, Randall, I'm going to assess your wrist. Make a fist. And I'm going to try to push down and then push up. Okay, next, bend your elbows. Okay, straighten your elbows. Turn your palms up. Turn palms down. Okay. Next, put your thumbs together. Okay, just make a fist. I'm gonna try to bend your elbow. I'm gonna try to push it down. Okay, very good. And then straight out and try to push it down. Don't let me. Same this way. Okay, I'm gonna inspect Randall's shoulders. Okay, I'm gonna inspect your shoulders and girls. So this way. Okay. No swelling, no deformity, no fasciculations, no atrophy. I don't see any abnormal positioning either. Okay. Let's see. Okay, I'm gonna assess your flexion. So I'm going to assess your flexion. So raise your arms up front and over your head. Okay, raise your arms behind you, backwards. Okay, very good. Okay, and then raise your arms to the side and over the head, and cross your arms in front of you, and place one arm behind your back, and then the other one. Okay, and then place one hand behind your back, behind your shoulder, like this way. And then one is if you're scratching the back of your head. And then put this one down and do the same thing with the other hand. All right, next I'm going to assess your coordination of upper extremities by doing a finger to nose test. Okay, so you will put your finger to the nose, and then you will try to hit my two fingers, and I'll keep moving it. Okay. So go ahead, touch it. Okay, very good. Okay, now please stand up. Turn away from me. So, and then move closer this way, yeah. So I'm just gonna inspect Randall's spine and lower extremity. Okay. I don't see any deformity. He has a normal curvature. No, do you have any tenderness?
Nope.
Okay. Bend forward and touch your toes. Okay, very good. Bend backward as far as possible. Okay, rotate from side to side. Okay, bend to the side, from side to your waist. Okay, go ahead, sit back down the way you were sitting, this way. Very good. So I'm going to assess your flexion. So bend your knees while you're sitting. Bend your knees. Okay, straighten your knee, straighten your leg. Swing your lower leg towards midline and then outwards. Okay. Okay. Now, point your, I'm going to assess your plantar flexion. So while sitting, point your feet to the floor. Okay, point your feet to the floor. Okay, then point your feet towards the ceiling. Build your heel inward and bend your heel outward. Okay. Very good. Okay. Now go ahead and lay down. Okay, I'm going to go ahead and inspect Randall's legs. Okay, hair is evenly distributed. Color is even, symmetric. No, he doesn't have any varicose veins. I don't see any scars. No ulcers. Temperature is normal. I'm going to palpate his femoral, popliteal, and dorsalis pedis. Okay. Do you feel any tenderness?
No.
Okay. Any tenderness?
No.
Okay. So now go ahead and bend your knees to the chest. Okay. Very good. Okay. Like down. Now turn around, lay on your abdomen. Legs, okay, so lift your legs while you're laying down. No, just like with your thighs. Okay, very good. All right, legs away from midline. Legs towards midline.
I don't know that one.
Okay, external rotation. Bend your knees and turn your legs inward. Okay, bend your knees and turn your legs away from midline. Okay, very good. Turn back around. All right, I'm gonna inspect Randall's knee for any pleural effusion. There's no, I don't feel any fluid in there. All right, very good. You could go and sit back up, Randall. All right, now you can just go ahead and stand. All right, so now I'm doing the neurological assessment on Randall. Randall, go ahead and walk. Okay, walk on your toes now. Okay, hop. Knees bend. Okay, sit and rise back up and down. Okay, and then with your eyes, and then stand with your feet together and your eyes closed. Okay, and then the pronator drift. Stand with your eyes closed and arms held straight forward. Okay, I'm gonna inspect. You could go ahead, just sit back down. Perfect. I'm gonna inspect Randall's muscles. No tremors, tics, no fasciculations. No, everything is symmetric. I don't see any atrophy. I'm gonna assess Randall's hips while he is seated. Hand on thigh. My hand is gonna go on your thigh. All right, try to lift against resistance. All right, I'm gonna put my hand on your shins. Try to push him out against my resistance. Okay, and ankles. And then for your feet as well, try to push your feet like as if you're pushing on a pedal. So push him against my resistance and then up against my resistance. Okay, perfect. I'm gonna check Randall's reflexes. All right, first. Perfect, thank you. All right, so bicep reflex, I'm gonna, okay, very good. Now, sorry, that was the tricep. Now bicep. Okay, brachioradial reflex. Okay, knee joint reflexes, and then the same for this one. And then ankle reflexes. And then I'm also going to test for Randall's sensory. First one is going to be To the touch, can you tell me when you feel sharp or dull?
Sharp, sharp. Dull,
Okay.
dull.
All right. So he has felt. I don't need to test his temperature because he does feel dull versus sharp. Next, proprioception. So I'm gonna put your finger up or down, and tell me if your finger is up or down.
Down, up, down, up.
Okay, very good. And then vibration. Tell me if you feel the vibration.
Feel it. Feel it.
Okay, I'm gonna give you an object to hold. Tell me if you can feel the object in your hand.
I feel it.
Okay, what is it?
Like a coin of some sort.
Very good. Another.
A coin of some sort.
Perfect. All right, and that is it. Randall, thank you very much.
Thank you.